or not the task force was.
Yeah. Did you have any challenges with Ms. McClellan's association with Bennett Jones at all?
I think that is something that needs to be considered when looking at this issue. What we've come off of is a century of criminalization, prohibition, and incarceration of individuals who were involved with marijuana. What we're seeing now is large corporations and other entities trying to get some skin in that game legally. The composition of people who are involved with those large organizations may lead to some concern about the fairness of that.
Okay, so is there, with this legislation, the way it's written, does it favor certain, like for example, there's large companies out there now in the medicinal marijuana field. Does it favor those big organizations versus maybe new entrants, as you said, your term was new skin in the game?
It very well might. And I mean, one of the things that I've talked about is people who have been affected by criminal records for what will now be a legal activity. And that's one of the considerations that can be given to rejecting applications by those individuals. And of course, your question also touches on some provincial jurisdictions and touches on some business considerations that are well out of my expertise.
Well, it just interested in your opinion on independence and basically who benefits from this this new legislation, if there is obvious challenges out there with the legislation.
What I can say is that the young, marginalized, racialized individuals who I have represented and I have seen in court who have been criminalized because of past legislation or current legislation with respect to marijuana, there is not much benefit for them in this legislation to either redress their situation, improve their situation, and I think that is something that the committee should look at very closely.
Okay, Dr. Ware, I have a question for you. I'm going to challenge one of your comments saying that you know, it lacks high quality research, and I can see that in some ways, but we've been getting briefs, for example, from the Canadian Medical Association saying that the research is very clear for people under the age 25. There are clear associations with psychological problems and damage due to cannabis use. The Canadian Pediatric Society says the association also is very, very clear. Could you clarify what you mean lack of high quality research? I know the science isn't there for a lot of this, but as far as damage, would you agree that the evidence is very clear that people under the age of 25, there's clear evidence that it can cause psychological problems and sometimes permanent impairment?
So I think this raises the challenge of trying to interpret any evidence of risk. And I think you need to be careful when you make assumptions that the evidence is clear that there are risks. It's not just whether or not there's a risk, it's the magnitude of the risk, and it is the factors that contribute to that risk. So in the case of mental health, what became clear to us from a number of positions, the CMA, the Pediatric Societies being one, but the psychiatric associations, there are other public health, there were other perspectives that were taken into account, that the association between cannabis use and mental health issues on a wide range of scales is attenuated by a number of other things, not just the cannabis itself. And I've already talked about potency issues, which are not factored into many of these discussions. But the age of onset, the frequency of use, the modality of consumption, and then the socioeconomic factors that are surrounding the individual who is using cannabis at an early age, those all contribute to elements of the risk equation. And different studies factor these confounding elements in different ways. And so even when you speak to the experts, the medical associations and the pediatric associations are looking at a broad evidence base and summarizing, and the danger is summarizing into one line, a very complex body of evidence, but they're summarizing things and making position statements based on a review of evidence. When you speak to the people who actually do those studies themselves, you very quickly realize that they are themselves limited by the interpretation of some of those findings because of the differences in methodology, the difference in reporting, who uses, who reports use, how do they report the amount of use. So with all of that said, that's what I mean by the lack of high quality evidence and why it's so important that we get a better handle on what people are using, how much they use, when they use, and that we build our education programs to minimize those risks, not just of the drug itself, but of the socioeconomics and the social determinants of the people. Why are they choosing to use cannabis when they're 13 years old? That is something that we need to be looking at.
but is it safe to